A ChiroSecure research update. A study published in the journal Brain Science assessed whether 4 weeks of chiropractic spinal adjustments combined with physical therapy had a greater impact than sham chiropractic with physical therapy did on motor function in 63 subacute or chronic stroke patients. Outcomes were assessed at baseline, 4 weeks post-intervention, and 8 weeks follow-up. Data were analyzed using linear mixed effects models or generalized linear mixed models. The study concluded that 4 weeks of chiropractic spinal adjustments combined with physical therapy resulted in statistically significant improvements in motor function compared with sham chiropractic with physical therapy in people with subacute or chronic stroke. These improvements appear to be clinically important. Further trials involving larger group sizes and longer follow-up and intervention periods are required to corroborate these findings and further investigate the impacts of chiropractic spinal adjustments on motor function in post-stroke survivors.